Well, I'm sure that Tana and Roxanne have much more to offer too.
So hello, my name is Tana Russell. I am the Deputy Director of the Evergreen Council on Problem Gambling. My background is as an addiction specialist. So I have been working with populations mainly dealing with addictive disorders since about 2007. I have been with, thank you. Do I need to repeat that for the people online? Okay. Give my introduction. My name is Tana Russell, Deputy Director. I have been with the Evergreen Council on Problem Gambling now since 2019. I am the co-chair of the Washington State Gambling Counselor Certification Committee, and I primarily focus on training. So when we talk about training therapists and counselors to be certified gambling counselors, I'm one of the leads who will be training them to do that work. And we have maintained the Washington State Problem Gambling Helpline, the 1-800-547-6133 number for over 30 years now. So I'll be talking to you a little bit about Problem Gambling Awareness Month and what we're doing there. And I will also be closing with kind of circling back to this conversation of reducing barriers. So I'll come back to that that's my last slide. We'll get to more details on that. And then Roxanne will follow up. All right, so the Evergreen Council on Problem Gambling, we are a nonprofit. We have been around about 33, 34 years. We are neutral on gambling, but we do believe that for those who do suffer, and while most of the population can gamble and game without serious problems from it, for those who do, it can be quite devastating, even life-threatening. And so we do believe that help should be available to anyone who needs it as quickly as possible and in their language. Go ahead. So for Problem Gambling Awareness Month, March is National Problem Gambling Awareness Month. The theme is Every Story Matters. You may have been seeing some of ECPG's, we call it PGAM for short. So if I say that, that's just the acronym. You may have seen some of our PGAM campaign elements going around, and you can go to the next slide. Governor Inslee has proclaimed March as Problem Gambling Awareness Month in the state of Washington. And you can go to the next slide and I'll cover some of the things that we have been doing this month. We did have a live stream this last February, which you can watch on demand either on Facebook or YouTube, with Dr. Debbie Haskins and Dr. Carmela Washington Harvey. And the subject was Problem Gambling or Solution Gambling, how to support Black communities, cultural realities. So I got to interview these experts. They have been in this field for several decades. And they offer a really lot of great insight on that episode. And on the next one is our podcast. We have a podcast called the Connections Healthy Gambling and Gaming Podcast, where we cover all things related to not just problem gambling, but also responsible gaming and video gaming topics, even related to metaverse or equity in gaming and everything in between. Our two episodes coming out here soon. One is Recovery One Day at a Time with Rob Minnick. You can follow him on various social channels. And another one we're going to be recording tomorrow and coming out in a few weeks on raising awareness in Black communities with, now, at the time I created the slides, we didn't have our guest confirmed, but it'll be Chandra Parks with the Maryland Council on Problem Gambling on that episode with us. And then on the next slide, if you could. Thank you. This last Tuesday of this week was National Gambling Disorder Screening Day. And all this is basically to try to get gambling screens as easily available to people as possible. Of course, for those who work in this field, our hope is that for facilities who embrace this, they will then continue to do it every day of the year and not just on Gambling Disorder Screening Day. But again, it's in this spirit of trying to make access to help as easy as possible. So it's easy screening tools and referral resources. And you can see an example of Tulalip having a gambling disorder screening day at their facility. We now have an e-screener on our website open to anyone if they'd like to take a screener online and just get some feedback about it real quick. And you can go to the next slide. Also, I don't know how many of you watched the Super Bowl this year, but we have had a Super Bowl or a sports betting, excuse me, a sports betting awareness campaign running since last year. And we also released some articles and things leading up to the Super Bowl. And just in case you're interested, I did pull some of the betting reports from ESPN. Of course, sports betting has been going up every year for the last several years. And this year for 2024, there were 68 million adults betting and 23.1 billion dollars bet. Compared to last year, it was 50 million adults and 16 billion bet. And next. So our sports betting campaign, it's running right now, January to May. And our communications manager did give me a little bit of stats on how it's performing. Compared to last year, we're seeing a 112% increase on views so far and 155% increase on viewers. So it is being seen. You might have seen it or heard it on some of these channels or OTT streaming ads, etc. But it is heightening awareness, and it can also translate into calls to the helpline as well. And next slide. So lastly, this is circling back to that conversation we're having just a minute ago about reducing barriers. So one of the things that we are trying to focus on is increasing access to services for those who are trying to find it, and also increasing the workforce to meet that need. For access to services, we do have the online website directory, the helpline, which you saw on screen earlier and we've talked about. Those are available 24/7. Easiest one-stop shop for anybody to call, text, or chat and immediately get referred to certified gambling counselors near them, as well as GA and Gam-Anon meetings and other things. And of the certified gambling counselors in our state, about 95–98% of them also do telehealth. So they do virtual services as well. We are almost launching a problem gambling training for financial advisors, so that those who are having financial difficulties related to gambling, who want to go get financial advice from a certified financial planner, etc., can get that advice from someone who understands the impact of gambling disorder on the finances and gambling triggers that they'll need to be protected from. So that's coming out this year. And also culturally trained and diverse providers, of course, is always a great need. For workforce development, there is this, think of it like a golden thread from a person's journey to specializing in this field. First, they have to go to college and get their degree, right? That license that then allows them to get the state license through the Department of Health. And then that allows them to get this specialty add-on license to be a certified gambling counselor. So we have funding to help support students, undergrad, graduate, PhD students with the college degree portion. We also have funding for the training. Some of this training scholarship comes from the Healthcare Authority, some from the Recovery Cafe Network. This helps cover the cost of the specialty training on gambling disorder. It also covers a portion of a hotel stipend, and for those who are becoming treatment counselors, certified gambling counselors, it also covers that certification application fee. And once they are now providing those clinical services, Roxanne also has treatment reimbursement, but ECPG, we have treatment reimbursement. So she'll talk to you about hers in a minute, but we have also raised our treatment reimbursement rates to help pay for the services provided. And gambling disorder by its very nature generally leaves people broke. They just cannot afford treatment, understandably. So these funds help cover that so that the providers can still get paid for their work, and also to help reimburse them, because they often pay out of their own pocket to work with a supervisor, to supervise their work as they're new to it and learning the process. So we try to help support individuals through that whole thread from college to certification to practice. Oh, and the case conceptualization, this is something the Washington State Gambling Counselor Certification Committee created a few years ago. Anybody who gets this specialty certification does have to pass an exam. Exams are not necessarily the best measure of a person's counseling skills. Also, there's test anxiety, and for people whose first language is not English, that can be a barrier. So the case conceptualization is something they write out and then is reviewed by a panel of 3 and scored with the same scoring threshold as the exam. So that is all I have for you. If you have any questions for me, please feel free. And then Roxanne is going to be talking to you next about her program.
Good morning. Let me just get my PowerPoint set up and then we'll get started.
Oh. Is there a question from Steve Conway?
Oh. Sarah Conway, did you have a question for?
Yeah, I had a question about the training of our counselors and whether they're integrated into the behavioral health system, you know, or whether they're a specialty beyond that. I just guess my question is about how the training of our gambling counselors is tied into the behavioral health field. Because, you know, so often these problems that problem gamblers have are related to other things as well. I guess that was my question. It seemed like we have a very specialized training going on, and I'm curious whether it is integrated with the behavioral health training.
Well, thank you. I cannot speak for all college and university counseling and behavioral health programs, correct? But through the counselors and therapists that I do work with on a regular basis, the consensus seems to be that in those higher education programs, if gambling disorder is covered at all, it's very little. So it may be a guest speaker talks for 2 hours out of a 2 to 3 year program, and that's it. So the amount of training they get within their college programs seems to be quite little, and some will say none at all. The specialty training program is 30 hours, and it does not train them how to be counselors because they already went through that and they should already have that license. It teaches them how to apply that work as a therapist or counselor that they already have to working with clients with gambling disorder. Now, in terms of general integration, problem gambling integration for behavioral health programs is one of my most requested topics. If I'm presenting at another conference somewhere, that's very often one of the topics that's being requested because there is a lot that those in behavioral health programs can do without having a certified counselor on staff. They can screen and they can refer to specialists. They can provide education. They can provide case management. They can do outreach and engagement with their communities. There's a whole lot they can do to integrate to a degree and make sure that people feel safe to talk about that, and where needed, then refer to that specialist who can do the actual treatment piece for that. So we're trying to integrate it as much as possible, and it is something that I think the need for it is being seen more and more.
Yeah, the other question I have here is wouldn't it need to be integrated to get Medicaid reimbursement?
Yes, and I will let Roxanne Waldron talk about that in a moment because I think
Okay.
Medicaid is on her.
I mean, you have people got to realize I sit on the healthcare committee, so I basically get a lot of exposure to healthcare training, and I'm a little bit surprised that it seems like we need to get it integrated. That's all. I mean, to me, gambling disorders have a lot to do with other problems that people have as well, whether it be whatever it might be. But it just seems to me that needs to happen. Thank you.
I agree. Thank you very much.
One more question. Yes, Tana, could you remind us, generally speaking, again, just give us an idea of where the Evergreen Council's funding comes from?
Yes, it comes from a variety of sources, including tribes, including state contracts, including fee for service for different things. The tribes being probably the largest portion.
Can you give us a general idea, percentage-wise, where the funding is coming from?
I cannot off the top of my head. Maureen would be the one who could right off the top of her head. I don't know if she's tuning in, if she can answer that, or if it's okay, we could follow up in an email.
I think it would be good for the public to know.
Yeah.
So
Yeah.
if Maureen is here, that would be good to know. Or maybe you could give her a call. Is that possible?
I can.
Okay.
I can. Are we able to circle back after a break or something? Would that be okay?
Sure. Thank you, Madam
All right.
Chair.
Perfect. Thank you.
Thank you. Roxanne.
Hi. Thank you. So I will be presenting in just a moment, but I want to thank you, Chair Levy, and commissioners and ex officios for having me present today. And for the record, I'm Roxanne Waldron. I'm the State Problem Gambling Program Administrator within the Division of Behavioral Health and Recovery at the Healthcare Authority. And I do want to say also that our program is also neutral on gambling. We provide services to individuals and their loved ones who are negatively impacted by problem gambling. I know that there were a couple of issues that were raised. I'm thinking it might be good to address those now before I do my presentation. In terms of the training and integration, that is one of the recommendations that was in the Problem Gambling Task Force report that went to the legislature in December of 2022. So it is within the purview of the advisory committee that was created to track those recommendations. It's called the Disordered Gambling Advisory Work Group. And so we will be tracking how that's happening. We will be brainstorming about next steps on that. So I just want to make sure that that piece is not lost. It is actually on top, at top of mind for that group and for me. And then in terms of Medicaid and being integrated, so the way it worked with Medicaid, and I'm going to talk a little bit more about what's available, but with Medicaid, the state plan amendment to Medicaid was approved by the Centers for Medicare and Medicaid Services. It was in that process, the state needed to define what kinds of clinicians could provide these services. And so that is defined in the state plan now. And in terms of integration, most of the people, people that are providing that service, they're either already licensed mental health providers of some kind and or substance use disorder professionals. So they are already, that work is already integrated in terms of their practice. In terms of what agencies are doing, that is a piece that we are moving forward on and will be working on over the next, 3 to 5 years and going forward. So I'm just going to stop there, and hopefully that answered a few questions. I'm happy to take more at the end if there's time. So Tana just covered Problem Gambling Awareness Month activities, so I'm not going to go into any detail about that. We have a few things we do at HCA, but not the scope of what the Evergreen Council on Problem Gambling does. We will be expanding our scope now that we have some additional funding. So I'm going to instead share a few updates about work that's happening in the State Problem Gambling Program. And this work is the result of a lot of hard work on the part of many partners, including current and past commissioners and ex officios over the past 5 years, especially, and before. So in response to the Problem Gambling Task Force's final recommendations report, which I mentioned, which was delivered to the legislature in December of 2022, so a little over a year now, 2 companion bills were introduced in the spring 2023 legislative session by Senator Conway, who is here, and also by Representative Stearns, who is a former commissioner. So both bills moved through the legislature with bipartisan support, and the Senate version did pass. It was signed into law by the governor, and it took effect on July 1st, 2023. So that bill specifies the following changes to the State Problem Gambling Program. It increases funding for the program in 2 steps, and I think Commissioner Sizemore, you had asked this question. It is 55% in the first fiscal year, and the rest starting on July 1st, 2024. So that doubles the funding for the program going into the 2025-2027 biennium and beyond. So we're still in that ramp up period. So the funding, just to remind folks, is based on the business and occupation tax increase to commercial and charitable gambling, and an increase of the contribution from the lottery by the same percentage. It requires, another aspect of the bill is that it requires HCA to create a year-round problem gambling prevention program that is integrated with other behavioral health prevention efforts. And it also initiated the committee that I mentioned, the new committee to track implementation of the Problem Gambling Task Force recommendations. And it's called the Disordered Gambling Advisory Work Group, or the DGAW, with HCA is the lead agency on that. So I'm facilitating that group. This work group held its first meeting in November. It had its second meeting, as Director Griffin mentioned, on this past Tuesday, and will be meeting quarterly going forward. So in addition to the changes from the legislative bill, also HCA did receive approval from the Centers for Medicare and Medicaid Services to cover problem gambling assessment and treatment under Apple Health, which is Medicaid in Washington State. And the legislature also in spring of 2023 had approved the Medicaid state matching funds. And so as of January 1st, 2024, billing for problem gambling treatment services is now underway under Medicaid. So next, I'm just going to share a little more detail about all of those. For the problem gambling prevention expansion, the new legislation required, as I mentioned, the HCA launch an integrated year-round prevention program with community involvement. So to help guide this work, we formed the Problem Gambling Prevention Work Group, which is now meeting every other month for about 15 more months through June of 2025. It includes HCA staff from Division of Behavioral Health and Recovery and the Office of Tribal Affairs. It includes Gambling Commission, Department of Health, and OSPI, the Office of the Superintendent of Public Instruction partners, also gambling clinicians and prevention specialists. So the facilitation for that group has been funded by the Recovery Cafe and the Snoqualmie Tribe, for which the program is very appreciative. The focus of the work group is to help guide and provide feedback on the statewide problem gambling prevention program that we're designing. And the goal is that it will be included in the statewide prevention plan for all topics in 2027. They update it approximately every 5 years, and it just went through an update recently. So the primary focus for the problem gambling prevention work within the Healthcare Authority is youth and young adults, at least initially. The state program is also coordinating and helping to fund with the Evergreen Council additional media and outreach campaigns that focus on Black, Indigenous, and people of color, women, and the military. That's the current biennium. We'll be having additional focuses in the future. And we'll also be reaching out to tribal behavioral health agencies with robust problem gambling programs to learn more about their practices for community engagement, because that's a piece that is really new for our program. So next we have that workforce development piece that we talked a little bit about, Tana touched on. So again, the Problem Gambling Task Force recommendation report identified gaps in state certified problem gambling treatment services. And in this context, state certified means for sole proprietors or providers that the service provider is a certified gambling counselor or a certified gambling counselor in training that has appropriate supervision as defined in the WAC. So for behavioral health agencies, state certified means that the agency is a licensed Department of Health certified problem gambling agency, which means it has to employ or contract with at least one certified gambling counselor or one in training with appropriate supervision. So the identified gaps included, we found at least 11 geographic regions across the state that had no state certified problem gambling services within a 1 hour of drive time. And some of these have commercial and or tribal gambling nearby. There were a lack of clinicians who speak languages other than English, especially for populations known to be at increased risk for problem gambling. And this includes Spanish, Korean, Vietnamese, et cetera. And then there was a lack of PG services, problem gambling services within communities that are at populations that are at a higher risk for problem gambling or gambling disorder that also don't have problem gambling services within those communities. So again, this would include the Black, Indigenous, and people of color communities, communities with low socioeconomic status, and for the social determinants of health, there would be a lack of good access to healthcare, education, healthy environment, and food, and so on. And then finally, the lack of clinicians with lived experience within those communities or from those communities, because we know that often people feel more comfortable talking to someone who looks like them and or has had similar life experience. So here's the map that shows the 1-hour drive time regions of the state, which have a gap in services that we are focusing on to increase access to state certified problem gambling treatment services. So what is highlighted on this map are the geographic areas that we have gaps. Not highlighted on this map are the areas where we need certified gambling counselors who speak languages other than English and or have lived experience of communities that are at higher risk for problem gambling that are currently served. So there are more places than just what's on this map. This just gives you the geographic idea. So to fill these identified gaps in the state certified problem gambling provider workforce, and I know Tana touched on these, so I'll just go through them quickly. The State Problem Gambling Program and the Evergreen Council have launched a workforce development initiative. So we're using a multi-prong approach, and all of these are available to tribal and non-tribal behavioral health agencies. We are training additional certified gambling counselors to fill those gaps in region, language, and lived experience. We are doing outreach to existing DOH licensed behavioral health agencies to urge them to identify one or more clinicians that they're currently employing to become certified. We are encouraging agencies that accept Medicaid to employ, train, or contract with new and current certified gambling counselors. We're also offering the enhanced scholarships that Tana had mentioned, up to 100%. For training and supervision to become a certified gambling counselor to fill those needs. And that is open both to individuals who want to become certified gambling counselors and also to agencies that wish to train counselors. So as of January 1st, 2024, with the additional funding, as was mentioned, the State Problem Gambling Program increased our treatment reimbursement rates by 25 to 56%. And the difference is some were at a higher rate already, others needed to be brought up. So the most significant change is we changed the hourly rate for encounters for individual, family, and couples from $80 an hour to $125 an hour. So that was the biggest jump, bringing us much closer to market. And it's also in line with what Medicaid is paying now. So we've done a job of really working to coordinate those payments, to be very similar. And then we're also accepting applications in the state program. I'm accepting applications for agencies or individuals that want to contract for problem gambling treatment reimbursement. I haven't had the opportunity to do that before because we didn't have adequate funding to expand that, but we do now. And so far we've added one contract already in February, have a couple more agencies that are interested, and we haven't even done a big reach out yet around that. So that's exciting. So the last update is the coverage for problem gambling treatment services in the problem gambling task force report. So as of January 1st, the problem gambling has been added to Medicaid billing guides for both managed care organizations and fee-for-service clients. Billable services under Medicaid include assessment and individual, conjoint, family, group sessions. There is no case management or supervision included in that. Case management, if the service is provided by a substance use disorder professional, they can use the coding for case management under SUD. And then behavioral health agencies that accept Medicaid and are problem gambling certified by the Department of Health are eligible to submit billing. So this includes both tribal and non-tribal behavioral health agencies. Again, as was mentioned, sole providers, that is certified gambling counselors that are not affiliated with an agency, they can't bill yet. This is HCA, we're working on how we can expand this billing to sole providers under Apple Health. This has to do with the state Medicaid plan and the portion that was changed to allow this service. And then the state program, which I manage, will continue to serve non-Medicaid eligible clients. So for our problem gambling contracted agencies, as of April 1st, 2024, we're requiring all Medicaid enrolled clients that they should be moved over to Medicaid. So to access services, individuals can contact the Problem Gambling Helpline for referral or assessment at the 1-800-547-6133 number. And here's my contact info along with the Problem Gambling Helpline again. And clients can also reach out to me directly or the Evergreen Council on Problem Gambling. Together, we support a no wrong door policy. Come in wherever you can. And so thanks for the opportunity to present today. I think I might be over time, but I am happy to answer questions if there are any.
Great. It looks like we have a question from Senator Conway.
Yes.
Yeah, my aide told me that there was an answer to the question I had. During the Super Bowl season here, I was listening to the Puyallup they had some great problem gambling presentations
Right.
during those games. They did a great job. I was very impressed by them. But I noticed that they were referring people to the national line
Mhm.
instead of the state line on problem
Mhm.
gambling. And I
Mhm.
just kind of alerted me to the fact that, you know, there's a little bit of confusion out there as to what line should we be using? Should we be using the national line or the state line of problem gambling?
So the fact is that that will lead you to the same place. The national line will be referring you to the state lines unless there is a state that does not have its own state line, then they will be referring you, I believe, and maybe Tana can confirm this, to the same place where all the other state lines, many of the other state lines end up anyway, which is the Louisiana Council. So we have the Evergreen Council in Washington State. There's the Louisiana Council that's in Louisiana, but they are a clearinghouse for referring to other states for those states that have contracted with them,
good.
which includes Washington State. So it's all in the same path. So I think what Tana was referring to is not so much that we're going to replace our line, but we just want to be a little bit careful about publicizing the 1-800-GAMBLER number to make sure that it is working to transfer calls to us. Does that make sense?
That makes sense.
Okay.
The other question I have, Roxanne, great
Yeah.
presentation, by the way.
Thank you.
You know, I need to get together at some point.
Yes.
Now that I'm free from the legislature, perhaps we can do that. But I was curious, do you have a financial statement in terms of the dollars that are coming in, the dollars going out? Have you, does your group have the advisory group get a financial picture of where we're at?
That would be a great thing to do. I actually have that on my to-do list to request that from our accounting division. So I'll follow up on that and then I can share that with the disordered gambling advisory work group.
It would be a value because then we can know, you know, what we may be needing to do on this area. So thank you.
Yes. But essentially, we're moving, just a quick overview. So we've been at about 1.4 million for since the beginning of the program, up or down a little for each biennium. So that was around 750,000 per year, compared to, let's say, Oregon, which has 10 million a year, for example. All depends on how the state sets it up, right? So now we have moved to 2.8 million, which will be doubling. So we'll have the 1.4 million per year roughly. So a lot of the work that I'm working on now with our partners is to expand, use that money to expand services we haven't done before and then make more robust the services we do have.
Thank you.
Thank you for the opportunity to share.
Thank you. Any other commissioners have questions? All right, well, thank you, Sam.
Thank you.
And
Chair, I do see that Maureen Greeley is on camera. Do you, she may be wanting to respond to your question.
okay. Hi, Maureen. Were you here to respond to a question that was asked earlier?
I am. I heard that there was a question about percentages of funding to our nonprofit organization.
Yes, thank you.
Absolutely. For the record, Maureen Greeley, Executive Director of the Evergreen Council on Problem Gambling. I can give you broad percentages given the amount of time that I just found out about this. I can't drill down real far, but I can tell you that of our annual budget for our last audited budget period, which was the year ending December 31, 2022, because we're in our current audit for 2023, 63% of our funding came from tribal contributions, individual contributions, and corporate. Now, while I don't have the exact amount, I will tell you that the bulk of that is going to be from tribal contributions. 25% of our funding came from contracts. That would include our contract with the Washington State Healthcare Authority, individual tribal contracts for services outside of X2 amendment funds, and contracts with other states and other programs. And about 12 to 13% comes from our own program fees. For instance, we do 4 different training conferences each year. There is a fee to attend those. So when we have fees for our own services, then we put those in our program fees. So that's a broad breakdown. I'm happy to come back again in the future and give you more detail if you'd like that, but I hope, Commissioner Patterson, that might help with your questions.
Thank you, Maureen. It would be interesting to know of the 63%, what percentage is coming from corporations, individuals, and tribes? But I know you don't have that today.
I don't, but I would estimate just off the top of my head that of that 63%, probably about 2/3 of that is coming from tribal support. And again, don't tie me to that number, but that's what I would estimate just off the top of my head. The bulk of our funding does indeed come from support from tribal nations through their X2 Compact Amendment funds.
And has funding been stable, going up? How is funding going?
It varies every year. Because as you know, tribal nations can choose where to give their funds, and some of them use the bulk of their funds for some very strong programs they offer themselves. And so every year our tribal funding can vary substantially, but we have seen fairly consistent support since the tribes began providing funds for this program through their X2 amendments.
Thank you.
You're welcome. I can tell you our total budget, just to give you an idea of what that 63% represents, ranges, this is where it does, excuse me, does vary every year, ranges from about $750,000 to $1 million. So there is a variation of up to 250,000 in any given year, depending on what types of contracts, programs, and services that we receive funding for.
But again, your funding is keeping pace with inflation.
I can't actually say that's always true. No, some years yes, some years no. During COVID, obviously, we took some big hits, but we're starting to get some momentum again and seeing more contributions coming in the last year and this year.
Thank you.
Thank you, Maureen, for coming on so quickly and answering that questions. And I see that Roxanne, your hand is up. Do you have more to add to that?
Yeah, I just wanted to clarify something that I said because it could be, I said it correctly, but I want to make sure that the intent is there. When I said that Oregon has like 10 million or other states have more, I want to clarify, first of all, there are states that have no funding at all. So we are very grateful for funding. Secondly, what I was reporting is the amount of our state funding that we have coming in from commercial gambling and the lottery. There are 3 to 4 million that's coming in annually from those X2 funds that Maureen was talking about that is available within the state to the Evergreen Council to use within the tribal behavioral health programs and other programs. So if you add that in, it's actually much more significant across the state. The piece that we don't always know is how, exactly what the tribal funds are going for. But in terms of what I'm focused on, it's how we're running our state program. So when I say we'll have 2.8 million, I'm referring to what the state program will have for the biennium. So I just wanted to clarify that we do appreciate the work our tribal partners are doing.
All right, thank you. Thank you, Hannah, Roxanne, Maureen. We appreciate all the good information today and appreciate you joining us.